a step towards antibody testing.
The key thing for us to do is now to evaluate, are these tests accurate enough to be used by the general public?
The virus has a knock-on effect for cancer sufferers.
Cancer patients have to live with uncertainty, but this is a new level, a new layer of uncertainty.
And advice for couples spending more time together than usual. This is Coronavirus, the latest from the Telegraph. I'm Theodora Louloudis. The public may be able to test themselves to see if they've ever had coronavirus within a matter of days. Director of the National Infection Service, Professor Sharon Peacock, today told MPs the tests would be available from Amazon and Boots. They could allow key workers like doctors and nurses who are currently self-isolating to go back to work if they've developed antibodies, which could mean they're immune to the virus. 3.5 million tests have been bought by the UK, but the government's Chief Medical Officer, Chris Whitty, said the test kits are yet to be approved.
I want to be really clear about what we can and can't do. We certainly have acquired for the UK a lot of tests. The key thing for us to do is now to evaluate, are these tests accurate enough to be used by the general public? And if the answer is they're all incredibly accurate, then we will work out the most quick and effective way to release these. If it turned out none of them were accurate, we would not wish to release any of them, because inaccurate testing is something which we really should be avoiding.
Belgium has developed a new test that can diagnose COVID-19 in just 15 minutes. While the test is only thought to be about 70% effective, Belgian health authorities have approved it for sale.
Can you all go home, please? It's not a holiday, it's a lockdown.
Not the most relaxing sound when you're sunbathing, but that's exactly the intention of the police officers heard there, breaking up groups of more than 2 people sitting on the grass in London's Shepherd's Bush. From Wednesday, authorities can issue penalties starting from £30 to those who flout Boris Johnson's social distancing rules, and magistrates can impose unlimited fines. An exclusive Telegraph survey found that almost 4 in 5 people are following all or most of the government's latest advice on coronavirus. And the Metropolitan Police Commissioner, Cressida Dick, said it was mainly individuals who weren't heeding the rules in the capital.
I'd have to say at the moment, the businesses that should be shut are shut. The sort of events that shouldn't be happening aren't happening. And there are some people who my officers have been speaking to. I've been out in the West End this morning. I'm out here in Battersea this afternoon. I've witnessed it. I've been part of it. Well, they simply don't understand that they shouldn't be sitting in a group in the sunshine. And so we've been able to advise them to stay socially distanced.
The Telegraph's Home Affairs editor Charles Hymas says police powers could be extended further if the rules continue to be broken.
This is, in essence, a sort of a halfway house. It's not quite as restrictive as we've seen in Italy or France. And what the police are warning is that if the public don't abide by these, then we could see much tougher restrictions. This includes things like barring you from leaving your house without having written permission or authority, and the power for police to ask you what you're doing and where you're going and why. And then also, in the last resort, things like roadblocks. Clearly, this is something that is not in tune with what the police really want to do, which is to try and police by consent, which is why they're essentially trying to operate on the basis that they negotiate, advise, and cajole people into abiding by the instructions of the government. As of Tuesday, police started to act on that, and at least one force issued guidance to their officers that they should persuade, cajole, negotiate and advise the public to follow these lockdown restrictions, and that enforcement would only be something that would be used as a last resort. What we saw then was a number of incidents where, for example, police in the West Midlands broke up a barbecue where there were more than 20 people, interestingly most in their 60s, who initially refused to do so that the police had to knock over the barbecue, and then they posted a picture of it on Twitter to underline their point.
More than 400,000 people have signed up in a single day to volunteer with the NHS after Boris Johnson appealed for healthy people to come forward. The helpers will deliver food to the vulnerable, drive patients to appointments and call isolated people. Around 11,000 former medics have also agreed to return to help ease the pressure on the health service. Cancer sufferers are among those whose treatment has been postponed because of the strain the virus is putting on the healthcare system. One East London hospital is postponing chemotherapy and other outpatient appointments for at least 2 weeks. The threat to cancer sufferers is twofold: the risk of delaying treatment and also the effect some cancer treatments can have of suppressing the immune system, making cancer patients more vulnerable to the virus. Earlier, I spoke to oncologist and former director of the World Health Organization's cancer programme, Professor Carol Sikora. He told me it should be possible to keep cancer treatments going.
Our NHS England has drawn up a list last week of 6 categories for chemotherapy, of priority categories, and 5 categories for radiotherapy. They're sensible, and it's the way forward. The trouble is, different hospitals are enacting it in different ways. There are patients almost certainly that are being cancelled whose lives will be impaired because of that blanket cancellation. There are 2 fascinating papers, one that's come from Wuhan and one that's come from Novara, right in the heart of the Italian pandemic area in northern Italy. And both look, and they've only been released in the last 2 days, both look at how cancer services continued in those countries right through the heat of the pandemic, and they managed to do it. So if they can do it in Italy and China, surely we can do it here. Cancer patients have to live with uncertainty. They've got used to that with the cancer, but this is a new level, a new layer of uncertainty that's suddenly been added through no fault of their own. It's very difficult to cope with it.
WhatsApp Messenger can be a bit of a minefield at times like this. Many of us will have received messages that start like this.
My sister, her boyfriend's brother, works for the Ministry of Defence.
It seems that everyone has a son who has inside knowledge from his friend in the army, or a cousin whose pal is a medic on the front line insisting they know how to prevent the virus spreading. It's hard to know what's true, what's not, and which ones are simply a joke. But there's one WhatsApp group the government is encouraging us to take more notice of. Their own. They've launched a free service aimed at providing trustworthy information to reduce the burden on NHS services. The automated chatbot will also allow the government to send messages to all opted-in users if required. The only problem? It doesn't seem to be working. There were widespread complaints on social media, and the Telegraph sent several questions with no response at all. It's the advice that sparked awkward conversations between couples up and down the country. Live together or don't see each other at all. Deputy Chief Medical Officer Jenny Harries told people in relationships to make a choice and stick with it.
What we do not want is people switching in and out of households. It defeats the purpose of the reduction in social interactions and will allow transmission of disease. So perhaps test really carefully your strength of feeling, stay with the household either together or apart, but keep it that way while we go forward.
One couple who's done just that are Eleanor and Tom. They told me they hadn't considered moving in together before, but were feeling positive about the decision.
And I think with regards to tearing each other's hairs out, I think we're both prematurely balding, so make of that what you will.
That's not true.
I think on a serious note, it'll be a really nice test of our relationship. We were friends before we started dating, so I think it's a good time for us.
I'm sorry to say, Eleanor and Tom, but we are just a few days into the lockdown, and as time goes on, tempers might start to fray. One of the UK's leading divorce lawyers, Baroness Fiona Shackleton, even warned in Parliament she expects a rise in divorce rates following periods of confinement. So, if you've made your choice and stuck with it and moved in with your partner, how can you make sure the outbreak doesn't spell the end of your relationship? To be honest, my top tip would be to take your one bit of exercise outdoors separately each day to give each other some space. But someone who's much better qualified than me is relationship coach Jo Barnett. Here are her top tips for staying together whilst you're forced to stay together.
First of all, what I suggest is that you structure your time. So you have some routine, because at the moment, one day rolls into the next. And what's meant to be very important is having a ritual. You can have a couple of rituals. For example, every lunchtime you sit in the garden and you have your lunch out there and you switch off your phones and social media, and it just becomes a relaxed, pleasant time for you to enjoy each other and just chill and have a bit of time just for you. You don't need to do everything together, and I very much suggest that you don't, so that when it comes to the evening and you sit down or you play a board game or you watch your Netflix, that you appreciate each other. You know, you haven't been on top of each other all day. Have space where you're apart, and then have space where you're together.
If you have a question you'd like one of our experts to answer, maybe you'd like clarification on the lockdown rules, or perhaps you'd like me to review the best video messaging services, email me. It's coronaviruspodcast@telegraph.co.uk. This is Coronavirus, the latest from the Telegraph. I'm Theodora Laludis, and I'll be back on Thursday evening with another update. In the meantime, you can stay up to date with my colleagues' brilliant analysis of the situation. If you follow the live blog on telegraph.co.uk, you really will be as up to date as you can be. Trustworthy journalism is more important now than ever, but producing it takes time, and time, as we all know, is costly. Our subscribers are the ones who make it possible. Please do consider joining them. If you subscribe today, you can access all the journalism on our website for free for the first month, and after that it's just £3 a week. Go to telegraph.co.uk/audio.